Hi everyone. Hello.
Hi, hello. Today we are stepping in a place where the science meets smiles and total makeover of confidence. Meet Dr. G.
Hi everyone. I am Dr. Konstantin Weingarten. I go by Dr. G. And welcome to our practice. So what's up?
We are here today to talk about a good smile. I want to find out how does it happen, how people make decisions. I mean, I know because I've been looking for a dentist for a while, but you're not just a regular dentist.
No, we're so much more than just being dentists. Although, of course, Dr. Bogert, Dr. B, and myself are dentists by education. But each dental office is special. And I'm saying it respectfully to my colleagues all over the world because although we have some basic education and we share a common knowledge in the industry, we all do things with a little twist. And that's what makes us different in a good way. And today I'll try to deliver our message to you and to our viewers how they can obtain smiles of their dreams.
Because smile, it's not just about the look, it's about the feeling of being confident, right?
Absolutely. And some people are just fortunate to have nice smiles, beautiful smiles by birth. And I generally envy those people and I see those people every so often. But more often than not, the smile needs to be enhanced, right? And we're talking about health of the teeth and the looks. And in many cultures, like our culture, smile has a huge social economic meaning. Also, it boosts one's self-esteem and opens many doors. It could be personal life, like relationship, new chapters in romantic life. It's a career, right? Because when people are going for interviews or just meet other people professionally, inevitably we're looking at each other, and we make this like first impression. And I think smile is a huge, huge part of it.
Yes, everything looks better with the smile, right?
Absolutely.
Dr. G, tell me, what inspired you to become a specialist in implant dentistry?
Well, I've been doing dentistry for more than 25 years. It sounds like very substantial, like quarter of a century. And I placed my first implant around 2001. And when I was placing my first implant, I was just kind of doing something new and something what was necessary for the patient. Of course, I had good supervision. As a matter of fact, I was one of the developers of implant Nobel Biocare, Dr. Jack Han, and he's very well known in the industry. But when I placed my first implant, it was like completely uncharted territory. And then it just unfolded on its own and it became a huge part of my practice. And for those who place implants, we know that it's a very complex discipline that requires a lot of knowledge, skill, and even if when things appear to be easy, and we'll talk about that later, there is a very, very sound foundation for those things to look easy and to work well.
So to look nice, it's not always nice and easy work, right?
You know how sometimes people do sports or play music instrument and they make it look easy,
Yes.
and you think like, oh, you just jumped, spun
Right.
three times about yourself. Why not four? But then try it yourself, and early on you realize that there is a lot of skill, hard work, and dedication to get to that level. And the implant dentistry and good dentistry in general, it's definitely one of those topics.
I'm gonna talk from my experience, like just sitting on this chair, like my heart beats like so hard because everybody is let's put it this way, everybody is stressed out about doctors, especially dentists, I think. What would you say to people who are afraid, not just regular filling, but they're afraid of coming, hey, I'm missing a tooth, what can I do? Because we are afraid. Let's put it this way.
When I'm a patient, and of course I'm a patient at times, it has to do with actually dentistry as well, or some other parts of medicine, like sports medicine. I'm no stranger to some trauma after sports. I'm not a hero. Actually, I'm a chicken. And for my colleagues and doctors who are my providers and they're watching this, they can confirm this. But the question is, why why one is nervous. Is it most typically, I think it's the fear of the unknown, right? So you're afraid of things that you don't know. So when patients come to me personally, what I'm trying to do, I'm trying to put them at ease, right? To have a nice conversation, to explain things in a very simple language, and set up the expectations right, and of course I like to exceed the expectations. And my favorite moment is when patient comes for follow-up and sits in this very scary chair, and she tells me, oh, it didn't hurt at all, or it wasn't as bad as I thought. And of course you're a hero, your staff is happy. Does it happen all the time? I mean, with all honesty, no. I mean, it does happen in many cases, and we're very happy and proud of that. But sometimes there is some discomfort involved, there is some pain involved, and we're open about that. That's why there are, painkillers after the surgery, and we encourage our patients to take them accordingly, not to kind of toughen up and wait till the last moment when the pain is unbearable. Definitely do not plan like big family events, right? So because your face might be like a little swollen, or you might experience some discomfort talking and chewing. But as I mentioned, in most cases, we exceed our patients' expectations. Another fear is like during the actual procedure, right? Pain, right? Let's say the obvious word. So again, there are ways to overcome this. We, of course, are using very strong local anesthetics, right? So the area of we're working at is completely numb. And before numbing the area, we're using a super potent gel that numbs up the area before we actually deliver anesthetic. And for patients who undergo big procedures, or just, naturally phobic, for whatever reason, just because they don't feel comfortable, or maybe because they had some previous experience, we offer different levels of sedation. It could be twilight sedation. Maybe you experienced that when you had like procedures like endoscopy. I've had it done for me like twice or three times. And you don't remember anything, you don't remember the procedure, and actually you feel quite refreshed after that. Or it could be general grade anesthesia, like, when they do procedures, surgeries at the hospital, when the patient is completely out. And we utilize different levels in our office.
Twilight, it sounds so cool, actually. Like you said, it was refreshing after, so.
Yeah, I mean, I don't want to promote, heavy-duty drugs that are involved with twilight, but for, obvious indications and medicinal usage, it's very, very helpful, and it works very well.
Okay, so we've got options. I know there is a lot of myths, and I'm sure you come across clients with patients that they'll be asking you questions, and you're like, no, that's not true. So what are those questions?
I mean, there are a lot of like misconceptions and misunderstandings, and social media sometimes doesn't do justice educating patients, right? Because they get like different bits of knowledge from sometimes not so trusted resources. And not in the order of importance, but I'll share some of the most common myths that I hear. Although we place a lot of implants, and as I mentioned, I've been doing it for more than 20 years in my career, implants are not better than teeth. Okay, guys, I'm stating this very openly and professionally. Do we place implants? Yes. Would I get an implant myself? Which, as a matter of fact, I do need an implant. One of my teeth broke, right? Yeah, I mean, yeah, so I absolutely believe in this technology, but by no means an implant is better than a tooth, okay? So when people think and tell us, oh, let me remove all of my teeth and get like full mouth of implants, along the way they're confusing implants and veneers and all this terminology. So if we can preserve teeth, that's another huge part of our practice, right? So we're not just dental implant specialists. I'm a periodontist, so is my partner, Dr. Bogart. So we're focused mainly on health of gums and teeth, and we do everything possible to save teeth and to maintain the health of the gums and improve not only health, but sometimes even the aesthetics of the gums. So it's, yeah, you can say it's plastic surgery on the gums, which kind of sounds very strange, but for someone who needs it, he or she understands it very well. And part of our practice, when teeth or cannot be saved for whatever reason, or when they have very bad prognosis, then we consider replacing one or several or all of the teeth with dental implants, but not because implants are better than teeth. I hope that doesn't make sense what I'm saying. So that would be like big myth number one. And myth number two, that dental implants magically make things look pretty. No, dental aesthetics, and when I talk about dental aesthetics, it's the looks of each tooth individually, like the shape, the color, right? Also, very important, the shape and the contours and the whole like assembly of the gum around the teeth, right? Because white teeth, they don't exist without, nicely looking gums, especially for individuals, mostly young ladies, but not only ladies, sometimes gentlemen as well. When they smile, you can see a lot of gum, and those are the most challenging cases. So to go back to my point, dental aesthetics and good looks, they exist not because of the implants, but despite of the implants. And I'll try to explain it. When we place an implant, it's a medical device, right? It's an artificial fixture, like, screw, for simplicity of the language. And we're trying to hide it inside the bone, under the gums, and create an illusion of a beautiful tooth or teeth emerging from the gum, right? So we have to hide things very well. Like for someone who had plastic surgery, typically that person doesn't want other people to know that he or she had plastic surgery. There are some extremes when it's very obvious and people exaggerate those things. But as a general rule, people want to look great, they want to look natural, and nobody knows what the hell happened. You know what I'm saying? The same with dental implants. So to make dental implants, especially for large cases, full arch cases, or like our patients are saying, full mouth of implants, to look beautiful and natural, it's a lot of work and a lot of magic.
I saw this magic happens a few times because it's not like right away you decide this is how you're gonna look like. It's a process. I saw how you talk to the patient, how they trying to pick the perfect shade, and then between those permanent and this work, it's also like temporary teeth, right?
Yeah, they're called like temporaries, temps, provisionals, prototypes. It's all like different words, but basically for the same part of the treatment. When before getting the final or permanent, again, different terminology, bridges or crowns or teeth. Let's put it teeth. Usually, in most, I would say in most cases, we have one or several sets of temporaries or provisionals. But not only they help patients to obtain function and aesthetics almost instantly. Also, it helps to test drive those teeth and say, yeah, I absolutely love this. I would like to change this. This is great, but I have a little bit problem with my diction, and this part could be like slightly different. This is a perfect time to adjust nuances, like I say. I very much like word nuances because it's all about little details, right?
Yeah, because you don't do copy and paste.
No, that's what makes a huge difference between a cookie cutter approach, which does not work in dentistry. Yes, there are certain rules and proportions, and people want white teeth. We all understand this, but we all are created differently, right? And there are different proportions of the face. There are different nuances, like I say. And my task as a clinician, but also as an artist to a degree, just to make sure that the teeth that I propose to the patient, they would blend in perfectly into someone's personality, right? They would not only fit the frame of the smile, but suit the patient overall as a personality. Because, like we said many times, smile represents the personality of a human being, right? That's what makes helps connecting people, and to a degree delivers a certain message, right?
That's right. Missing a tooth is one thing, but you are very well known for full arch, right?
Correct.
You are a specialist in this field.
First of all, thank you. And, we get new patients every day who found us through not only social media, but ironically, even ChatGPT. Somehow a few patients found us through ChatGPT, and we're one of the, top providers in Chicagoland for full arches, and especially those natural looking gum-free, artificial gum-free type of bridges. They're called FP1 or natural-looking dental bridges. And As you mentioned, if somebody needs to replace one or several teeth, it's very important and we take it seriously. But absolutely the next level of the game, when people need to replace all missing teeth or about to lose teeth for whatever reason, right? And then it's a completely different level of professionalism, different set of skills, different requirements for equipment and dental lab support. And this is exactly when experience and clinical skills and thinking come into play. And there is a huge difference between someone who is relatively new to the game or is just kind of, trying first steps versus someone who is experienced and also well supported by amazing team, amazing equipment, dental lab, and has to be an artist to a degree because again, teeth, it's not just nuts and bolts, implants, zirconia, screw in, scan, print, deliver, like any other artistry. It's not about buying brushes, paint, and a piece of paper, right? It's someone who can create a masterpiece, who is very talented, but also who has been practicing a lot for many years, and also can deliver it on a canvas and interpret the reality, versus someone who can just kind of doodle a little bit, even if they're using the same tools. So I've been doing arches, full arch dentistry for I think more than 16 years. I did one of the first cases for my own mom, and I was reinventing the wheel to a degree, like it happened to many of us in dentistry and other fields of any skill or craft. And similarly, what happened when I placed my first implant, that doing full arch for my mom, it was the lower jaw on 4 implants, all on 4. Again, it unfolded on its own because the more I, explored this treatment modality, the more nuances I was about to discover, the more challenging it became, the more knowledge I had to obtain from different parts of the world. I, like many other dentists who keep educating themselves to deliver better service to their patients, we travel a lot. We go not only to different parts of the country, but sometimes we fly across the ocean. Like last year, we went to Lisbon, Portugal, to learn this FP1 type of natural-looking bridges from one of the finest clinicians in the field, Paulo Carvalho. And this is just one example, and to learn like gum grafting, we would go to another place. And a few weeks ago, I came back from Guatemala, and that was mind-blowing. About 120 doctors, dentists from all over the world, mostly from the US, but also Canada, Mexico, Brazil, Lithuania, UK, even Australia, So we all came together. It was a very noble cause. We were doing surgeries for people in Guatemala, full arches, and many lives, about like 60 arches were done surgically.
Wow.
And we have those pictures and photographs, and you can see it on my feed, on Facebook and other social media. So it was an amazing experience from humanitarian standpoint, but from learning experience, it was like going to the Olympics with the most advanced athletes, but instead of competing with each other, we were just, playing in one team. Does it make sense?
That makes sense.
I personally met doctors who are top notch in the industry. I learned a lot even after being doing this for 20 something years. So if I learned a lot, you can imagine that, other doctors who are less experienced and they came there, they learned even more. And for, it was like an amazing sense of camaraderie, common, noble cause, but also professionally, I came back as a much better clinician, professional, and human being, I think.
That's very good. I mean, I saw your social media. Obviously, I follow you. So I like those because you do share those things. And this is good. This is amazing that some people are like learning things and they just stuck with the knowledge and they think this is it, how I want to do it. And people like you who are like, okay, I know what I'm doing, but I want to do it better.
Absolutely.
And maybe someone have different approach and it's as good as mine, but it's going to be maybe easier, maybe more appropriate for this patient. So this is great that people like you, like we were like, okay, let's go and learn new things in different way of doing things.
Absolutely. And again, there are a lot of different industries, there are different parts of medicine, but dentistry, which is like much closer topic to me because I dedicated my professional career and life to that field of medicine, you know, it involves not only science, right? Because you have to learn basic science like anatomy, physiology, biochemistry, but also it has a lot to do with the craft, right? You have to do things with your hands. And combined with modern technology, because in my early days we were making teeth from beeswax, literally, you know, I would be sitting in the basement of the dental school during my residency and, you know, dripping beeswax and making teeth, carving them. Now we can do it all on the computer in a just, you know, split of a second, and then yeah, you can adjust it, modify it. But to get this skill in your hands, you have to learn it from the basics.
Yes, definitely.
Also, obviously, you have to be passionate about what you're doing. You always remember that you're not just making teeth, because this is the problem with some of the contemporary dental labs, because they're so detached from reality. They just see things on the computer, and some of those people, respectfully, have nothing to do with dentistry. They're just, you know, computer technicians, and they design teeth, or they could be designing other pieces of equipment, right? But for someone who is deeply involved in the clinical work, you just put everything together. You add your heart, your soul, your artistry, and then you deliver something amazing to another human being.
Yes, and you are definitely that person because I saw your interaction with patients. Like they will come hug you, they will say, send you gifts. I mean, they're really happy. But it's like new life when you have this smile.
It is. I didn't want to kind of take words out of your mouth, but it is new life. You know, even when I had my teeth done about like a year and a half as of now ago, and even my kids were making fun of me because I couldn't stop smiling. You know, being a dentist for 25 years, you know, I couldn't pass any mirror without like smiling. And even when I came to our office in Skokie, just after I got my temporary teeth, speaking of temporaries again, right? Because even the temporaries immediately showed me that, you know, this is how you would look like. This is new you. And I so much enjoyed it. I mean, you have no idea. So for someone who has been missing teeth for a long time, or had like really bad teeth and suffered from that, not just physically for not being able to chew the foods, and it's detrimental to the health, like for digestion, but also psychologically, not having self-esteem, being like feeling awkward with other people, and the list goes on and on. And then if we as dental professionals can reverse this process, I think this is like mind-blowing, and this is the one of the most favorite parts of my job, quite frankly.
You can actually go to ImplantWide or Smiling Chicago and check the video where Dr. G is smiling in every shot. Like I try to capture this because he's usually very serious, because it's a serious subject, but he does smile and he likes to smile.
I do like to smile, and I like to be very easygoing for my patients. I mean, if somebody, you know, wants me to be very serious, I can be very serious. You know, we all are serious people, especially surgeons.
Right.
I have all those diplomas and education from Europe and from Ivy League school here, and all those certifications and credentials, like many of my colleagues. But I'm not trying to kind of suppress my patient with my authority, because I want to be not authority, but rather a guide, right? I want to grab your hand and I want to walk you through this journey to your new smile, but to make it like as easy as possible. Although at times it requires some, you know, effort, and sometimes it's not easy, but I'm trying to make it as comfortable, as predictable, and as humane as possible. That's how I see my role.
So speaking of you being a guide, just tell us a little bit more about this, because I know you came up with a book, right? It's like for people like me who try to decide what they want, or what to expect, or what questions to ask, because like I'm missing it, dude. I am. And it's been
we can fix it.
It's been 10 years and I'm like terrified, like even sitting with you here, like I said before, I'm terrified of a dentist chair, but I don't know where to start. Like, do I come for a visit, or do I ask questions before? Like, what do we do? Like, we just pick up the phone and call you?
There are many different ways of making a first step, and psychologically different people have different preferences. Like for instance, I personally do not like voicemail, right? And many people use voicemail daily. I just absolutely dislike it. Sometimes I even like disconnect it at my T-Mobile operator, because I like to see text message. I want to see like FaceTime call or email, right? Because I don't want to be interrupted for something that is not like my priority. So with this being said, different people have different preferences in making this first step. Somebody wants just to send a text message on your social media, right, and get a response. But get a response not from some chatbot or from some remote call center of people who have nothing to do with your office, right? Just kind of business entity. But to see a response from
you, right?
either from myself personally, or from Dr. Bogart, or from one of our team members who is like very actively involved in the treatment, right? Who is like physically here in our office. Some patients prefer like a virtual consult before they come to our office. Some patients already know us and they want to make this in-person consultation. The reason I'm bringing this up, because as a relatively small local dental office and small business, we communicate with patients very directly, right? Myself and Dr. Bogart and our team. With this being said, I noticed that patients are asking, more or less same questions. I mean, which is understandable, right? And they have the same misunderstandings and misconceptions, which might hurt them, right? In terms of not making proper choices, or not knowing the full picture. And as I mentioned before, sometimes they're misled by social media and other dental practices, not only in the States but abroad, advertising their services. That's why, as I was kind of organizing my answers and structuring them, I came up with an idea that I can put everything in one body of literature. And we came up with a very easy to read book. It's only like 37 or 40 pages with pictures and some links and QR codes. And it just walks a typical patient through the decision journey to their new smile, and answers many questions that I personally have heard from the patients. And it was a fun project. It took me a few months, so it wasn't just kind of one time sit down and write it in one shot. No, and I was editing it and modifying and adding things and changing them. And we came up with the book, The Smile You Deserve. You can download it absolutely for free on our website, ImplantWide.com. And to make things even more comfortable, because remember, we talked about people having different preferences and having different time at their disposal. There is a brief summary of that book that you can watch with some diagrams and some visuals. I'm personally very visual, right? I want to see things. So there is that format on the same website. And even there is a podcast when, there are two people discussing our book. It's about like 15, 20 minutes. And if you like the content that you can, listen in your car or watch it on YouTube, then you can read the full book. And I'm working on the second book. It will be dedicated to, actually, I don't have the definitive name for the book, but it's going to be more about technology and how I say nuts and bolts and like different pieces of the puzzle that go into creating a new smile. But it will be more detail oriented, and it will help our patients to make more educated and wiser choices. And I have another project that we can talk about. It's about dental tourism. You know that we posted, you and I, quite a few reels and posts about dental tourism. The good part of it, the not so good part, the part that potential patients should be very conscientious about. But instead of just being an observer of this very important topic, and especially after my trip to Guatemala, when I yet again met a lot of great dentists from all over the world, I decided to be, part of the solution to this. I want to be an independent expert who can help our patients who are willing to travel to other countries, to connect them with verified providers that I personally know and trust professionally. And my criteria is like, would I sit in their chair myself? Fair? Fair.
Yes.
Do I want to travel, let's say, to a different country and sit in a dental chair? Probably not, because I don't have that much time and I can get those services here. But for some patients, it could be advantageous because they can receive high quality care and they can, save quite a bit of money, which is important. I mean, good dentistry cannot be cheap. But at the same time, they will be seeing verified providers. We will help to collect initial data, right? So we can help with taking x-rays, 3D cone beam CT scan, we can do optical scan, we can do high quality dental photographs. We can even actively participate in creating a dental treatment plan for this individual, because you don't want any surprises. You don't want to fly to, let's say, Colombia and find out that you have gum disease, and before you're getting those beautiful veneers that you see online on Instagram, given that those are real cases and not Photoshop. But then they're gonna shrug their shoulders and tell you, oh, you have gum disease, let's cure your gum disease during this trip. And it's not like they can cure it overnight and next morning you're getting veneers. So you have to get it treated there, given that they will treat it. Then you fly back, then you fly back again. Now you have like extra one trip, extra, set of treatment that you have to do. And all those things that add up. Also with dental tourism, what I witnessed that very often the quote received, over the text message exchange or like even online consultation, and what the patient are really facing when they arrive to this destination, it's very different. So we will help our patients to avoid those surprises. And on top of that, we want to provide support if anything goes wrong, right? And let's say something like temporary breaks or some other, or like little screw gets detached, and maintenance. So because let's say somebody got the full mouth of implants done in a different country, do you really want to fly to this country 2 times a year, 3 times a year, 4 times a year for cleaning?
Yeah.
It's not practical. But if you come to provider in your country, in the United States, in our situation, they might not even know what implants were used, how to service this, and many dentists will just refuse, maintaining those cases. So this is like my new project that I want to dedicate some time to, and I ran it by several people that I trust their professional opinion, and they all agreed that it was a very good idea. So if you are watching this and you're a provider from another country and you want to reach out to us and to get to know each other better and potentially participate in this project, so just reach out to us and we'll be more than happy to talk to you.
Let's say we've been putting up the decision for a long time. We decided, okay, I want to have new smile, I want to have new life. And how quickly I'll be having this new life, new smile?
First of all, during our consultation or meet and greet, my task is to understand what your concerns are, what your true dental problem is, because you might think about something and it might be not exactly what you think. So professionally and ethically, I have to diagnose you properly and come up with proper diagnosis, discuss with you options, how to solve this, and advise the best solution that I think is the best for you in my professional opinion, but also like ethically. And based on that, it could be a very easy solution. Let's imagine somebody is having good teeth overall, healthy gums, and she wants wider, bigger teeth and more straight. It's a relatively straightforward case, right? We can diagnose it, we can do digital smile design, so we can virtually show you how your teeth would look like, and we can make some adjustments even without touching your teeth, right? So, and then we can deliver that treatment very fast, especially having an amazing lab that can deliver very beautiful porcelain work, and it's local. You can, patients can go to that lab and discuss the nuances of the treatment, like some for highly aesthetic cases. Or versus another situation when somebody has been missing a lot of teeth or has had bad teeth for a number of years, has severe gum disease and some deformities because teeth moved all over the place. This might be a slightly more involving treatment, but even with those complex cases, sometimes they can be solved in almost like one day, and you might think like, how is that possible? And the answer is like, we have a lot of homework to do. So we have to collect all the data, and data is just certain records. It's thorough medical history, right? Because like any other medical procedure, patient can be a candidate or not a candidate for a certain procedure. And unfortunately, sometimes it's, neglected. Then we analyze the dental situation, and we're using traditional x-rays. I mean, of course, they're digital. We're using 3D scanning to get like 3D picture of bone and tooth structure and joints and other important anatomical landmarks. Then we use optical scanning to create this virtual model of someone's teeth and mouth and parts of the face. We use facial scanner, so that those teeth are fit in the real smile. And all those things, they go in layers, and as crazy as it sounds, after you leave, we have a virtual model of you, and I can work with this model without you. So I can create a project, like architects. I mean, first they draw a sketch, and then there is a serious project, and then based on this project and technical drawings and all this meticulous calculations, then, a team of builders can create a beautiful structure, like a building or a house, you know what I'm saying? So we would create this project using our knowledge, our expertise, and a lot of technology that we can use, right? And then on the day of the procedure, we would have everything prepared. Typically you go to sleep, right, with moderate sedation or twilight or general anesthesia, and then we start putting all those pieces together. Like I mentioned, my second book I'm working on. So those are the puzzles of the whole pieces of the whole puzzle that we start putting together on the day of the procedure. But they're not like some random pieces that we get out of nowhere. They're all meticulously prepared based on our thorough collection of all the diagnostic data. And on the day of the procedure, we remove bad teeth, we place implants, we use the previous project of teeth that were designed, and you already saw those teeth, right? And then we deliver those teeth on the day of the procedure. So to answer your question, sometimes we can do it in one day, as crazy as it sounds. Some treatment might require more phases, more steps. Let's say someone is missing teeth only in one part of the mouth and the rest of the teeth are fine. Of course, we're not going to sacrifice good teeth, but we'll be rebuilding bone in this particular area. And yes, Mother Nature sometimes takes time, like 5-6 months, but out of this 5-6 times, you're basically doing nothing. You're just waiting for the bone that we grafted or grew to mature, and then you come back, then we place implants. So again, there are a lot of like moving pieces, there are a lot of unique case scenarios, and for experienced clinicians, that's that's an exercise during the diagnostic phase, how to put things together and make it like the most optimal journey for you. And it's a good sign if the dentist of your choice, she or he can show you similar cases on their computer, photographs documented before and after. And again, everybody is different, but you can see certain patterns, right? Oh, this person also was missing front tooth, and this doctor restored, like he can show me 5 of those cases. If I pull up my computer and open like full arch cases, it's going to be like dozens and dozens of cases that I treated with my team, with Dr. Bogart, and we can show to a patient that, look, this is something similar, this is how we treat it, these are your options, and this is like the solution.
So you are the owner not only of ImplantWide, but also Smiling Chicago.
I'm a board-certified specialist in periodontics and fixed prosthodontics, which helps me tremendously to see the full scope of the treatment, especially involving full arch restorations and complex rehabilitations and aesthetic cases. And when I was starting these practices, my vision was just to have a team of people working with me in a very, very cozy, locally owned business environment, communicating directly with our patients, and delivering the best of our care, expertise, dental services, but in a very friendly, easygoing environment, and with the best of our knowledge, the best of the materials available, the best of the dental work. What sets us apart, that we're kind of happy medium between big corporate offices, and we all know those companies that have sometimes hundreds of offices across the country. And although they also provide services to the patients, sometimes they're more like a tooth factory type of setting. And I'm not trying to critique or insult anyone, but that's what we hear from the patients at times. And at the same time, we don't want to be those like extremely boutique type of practices with astronomical fees that are only affordable for a very limited number of patients for obvious reasons. It's very expensive. So we're trying to be to emphasize our personal care, our expertise. We use the latest technology, but at the same time we're very approachable, we're very affordable. It doesn't mean that this dental treatment is cheap and you can compare us to other countries, right? Because the economy is different in different countries. But I'm, sincerely convinced that what we deliver to our patients is a true value, right? Whether we're a good fit for each other or not, we can find out during our consultation, and we're very transparent about what we can deliver for you, what you should expect, what we expect from you as a patient. And we're very transparent about finances, how to make it happen. There are different tools. So we also provide with maintenance and aftercare. And we know all of our patients personally by name, and we become friends with many patients. It just happens naturally, not because we're trying to become friends. It's just because even when people come to us and they're very stressed and, like you said, like phobic, afraid at their initial appointment, very soon most of the patients get very comfortable. They open up, they realize that they're at the right place. You know how it feels sometimes in many parts of your life when you think, yeah, this is the right fit for me. It kind of feels right.
Yeah.
Feels right, and it's hard to explain. And sometimes everything is good, nice place. And I'm not talking about just dentistry, but but you think like, it's not my cup of tea for whatever reason.
Yes.
And being big boys and girls at this phase of life, you tend to trust your gut feeling for good. So we hope to be a good fit for you. We hope to exceed your expectations, and we hope to help you in this journey to obtain the dream smile of your life.
What's next? How do we take care of what we have? New smile.
As much as we're excited about your new smile, and I know this feeling firsthand, the reality is that, like many other things in life, your smile requires reasonable maintenance. Of course, your home care is important, and sometimes your personal oral hygiene habits can be improved a little bit, especially after you underwent this procedures and getting new teeth. So we'll definitely educate you and help you to treat your teeth and gums properly. Your regular appointments for, let's say it like dental cleaning, for the simplicity of the terms.
It's a little bit more than just brushing your teeth every
Even
day,
if you
right?
brush your teeth every day properly, although there are almost always few areas that patients miss. It's like, for instance, the inside of the lower teeth gets neglected quite often because it's hard to see and it's kind of awkward angle to reach with a toothbrush. For someone who has large dental bridges on teeth or implants, there are some hidden areas that are hard to clean. That's why we have special equipment to clean underneath. Sometimes we have to remove those bridges and clean and put them back. Sometimes we need to replace little screws here and there. Like any other elaborate entity in that, or
It's like your car.
it's like your car. I didn't want to bring
Mm-hmm.
this up, but like your car, right? Even the best car needs maintenance, and you want to keep it clean and
Yes.
as much as you can. And but if it's a nice car and you need to change oil, if it's regular car, not electric, do yourself a favor, change oil. I mean, don't wait till too late, or other pieces. And if anything breaks, just come back to a dealer, and they will help you out. And even if it requires some investment, I think it's reasonable, right? If you want to maintain your car in good shape, not only for the looks, but also for your safety, right?
Definitely,
and comfort. In terms of continuity of the treatment, also what really sets us apart from offices that are like large entities, there is a very, very strong continuity of your treatment, because as I mentioned, we're small locally owned business, and we know all of our patients personally. We don't have a revolving door for doctors and providers, because quite often in big dental centers, the surgeon who did the procedure is not available anymore, because he or she just probably left, or sometimes even went back to a different state. Sometimes they rotate, and now you have to tell your story over again to a new provider. And if it's one implant, it's one story, and if it's a full mouth rehabilitation on implants and some complex treatment, I personally want the person who did my teeth to be able to open his own records, electronic or otherwise, or his pictures, and to remember what they did, how to fix it, because I think it's much more efficient approach. Also, as much cliche as it sounds, but you're not just getting teeth, you're not just getting veneers or implants. I truly believe you're getting a lifelong relationship with people who care about you. And it's not only important for teeth or dentistry, for other fields of medicine and services. And you want to stay in touch with the guy who built your house, right?
Definitely.
So if anything needs to be fixed, or maybe you'll be building another house soon, and you loved what they did for you and you want to use their services. Just an example.
Tell me, what's your favorite part of this job? And don't tell me it's everything. Just tell me what's the favorite thing.
I'll be completely honest with you, and I don't want to complain, but it's a very hard labor. Being a dentist with all this glorious outside picture, it's a lot of work mentally. It's a lot of effort to become, who we are professionally. We constantly undergo education and our previous education and continuing education, so it's a lot of effort. It's a lot of physical stress, right? Because on your body, and especially when you're not getting younger, and the more experience you get, which is a good part, but then you're getting older just physically. True. And then you start feeling it a little bit. We start feeling it in our necks, in our shoulders, spine, vision, because we work with large magnification, and the list goes on and on. But guess what? If you're a patient at 9 o'clock a.m. or if you're a patient at 3 p.m., you expect the same top level of care and my attention, right? You don't want to think like, oh, he can be less attentive at 3 p.m. With this being said, it's a big commitment, and I'm speaking on behalf of all my colleagues and dentists and dental professionals and doctors in general. We made this commitment to serve people. So the best moments of my job is, I think, when I realized that we deliver this wow effect to our patients, and they finally see their new smiles, new faces. And it can happen in different phases of the treatment. It's not necessarily the delivery of the final product. Sometimes it can happen even during the diagnostic phase, when we deliver those try-in teeth after we design them. There are ways of kind of deliver them like as a mock-up, like we say. So when the person is able to see her future teeth,
Right.
but without doing anything in her mouth, irreversible. And it's usually a huge wow moment, because especially, you know what ladies do the first thing when they're handed the mirror? You want to do this experiment out of curiosity? So
I think I
I
know.
give you a mirror. So what do?
I fix my hair.
Yeah, that's what ladies do. But also they start looking at their
Yeah.
teeth, and they're, you know, and they start fixing their hair
Yeah,
even
and
more.
how does the selfie look like?
Yeah. So this is like I call it like a wow, delivering wow, and it could be like different things.
Do they
And,
cry?
you know, some of our patients do cry. Actually, again, it's another cliche, but you've seen it, I've seen it, our colleagues have seen it a lot, because it's a huge emotional, you know,
Yes.
relief, and people relieve their emotions differently. People start laughing, hugging, some people start crying, especially if they had some, you know, bad experience in the past and suffering, and you know how it is. And the second best part is exceeding expectations. It kind of goes along with the first part, but when you exceed someone's expectations, and it could be different things, the beautiful outcome, or for instance, when patients come for a follow-up and they tell you that after a very serious surgery, they barely took any Advil, which does not happen all the time, but happens quite a bit, especially if you're efficient, if you know, your procedures go smooth, fast, you don't cause unnecessary trauma, you give proper instructions, and truth being told, when patients take care of themselves as well, because this is very important, then sitting in this chair, they're looking at you, and despite the fact that they had, let's say, I don't know, 12 implants placed, they said like, no, I was fine, and thank you very much, it was much better than I thought. This is my second favorite moment. And my third favorite moment is when people bring when they recommend
course.
our services. And here comes the funny part. As a specialist, I treat a lot of you know, people, patients who are referred by other dentists, right? But then they would refer their team members, right? Their front desk, their assistants. Then they would refer their family members. Uh, it starts usually with mother-in-laws, and then father-in-laws, and you know, other relatives. Then they would sit in the chair themselves, right, as patients. And you know, because we're humans, we need the same procedures. But the ultimate level of trust, and my favorite part, is when they bring their kids.
Oh, yeah,
And
definitely.
I've done quite a few procedures for kids. And when I say kids, it could be as teeny tiny as 8 months old, to do like little frenectomy, like you know, this lip tie, or when they're kids but they're, let's say, 20 years old and they were playing basketball and their tooth got knocked out, and we're placing an implant for a young gentleman who is like, you know, kid of a referring doctor. This is like, in my hierarchy, this is the top ultimate level of trust, when they bring their kids. So those are three main things that bring me joy in my profession.
Tell everyone how we can find you on, because we can find you on social media, on websites. We can hear your podcast, right? We can go on YouTube.
We're trying to entertain our audience on different platforms, because you know, we have different preferences. I watch YouTube every day. Like, I enjoy photography besides dental photography, so I casually watch some photography videos just to improve my skills. Some people like Facebook, some people like Instagram, some people like TikTok, some people like LinkedIn. It's kind of more professional environment. And we're trying to tailor to all those preferences. And yes, our content overlaps here and there. Some people like to read books, so we publish some electronic books that you can download from our website. And if you have any questions, or if you want us to cover some specific topic, just reach out to us, reach out to Kinga, and we'll put it together, like in a very casual format, talking about very complex things in a very simple language, because it's a very complex field of expertise, right? And it took me personally more than 25 years to become who I am. And you know, we can make this journey much easier and much more condensed for someone who wants to educate herself about, how to get this new smile that she was dreaming of without becoming a dentist, so to speak,
Yes.
right? But getting like the important pieces of knowledge from, I hope, verified source, and because we're trying to position ourselves as experts in the industry, and we're trying to give you the latest knowledge in the industry, and to give you the most unbiased opinions, and so you can make more educated and wiser choices. Because what I see in the social media, sometimes there's a lot of misrepresentation
Yes.
of reality for, some commercial reasons to attract more patients to travel to a particular office, photoshopped images, fake reviews from people who, in reality never got this treatment. And we're just trying to help you to navigate through all this, fuzz of information that can be not only not useful, but even harmful for you. So hope it helps, and stay tuned with us for much more content, right?
Definitely.
And we'll make it happen. And thank you very much.
Thank you. And if you have any questions, or like you said, any subject that you would like Dr. G to cover, just hit us the email or message over the social media, or even comment, right? And
Absolutely.
we'll do it.
Thank you.
Thank you.